how should you choose your implant size? Well, ideally, the implant size selection is a decision that you're guided through by your plastic surgeon. And ideally, your plastic surgeon is using biodimensional planning principles to determine the ideal implant for you. The reality of breast augmentation is this. Based on what you're starting with, your breast base diameter, the stretchiness of the skin of the lower pole, the amount of breast tissue that you have to conceal the implant, there truly is a limited range of implant volumes that will work well for you and will produce an aesthetically desirable, full but natural appearing result. The problem with using implants that are too small is you end up with breasts that look somewhat lonely and separate, and the problem with going too big is you end up with a high risk of the problems that lead to reoperation for breast augmentation: visible folds and ripples, skin stretch deformity, and position problems like bottoming out. In my practice, I see in general two groups of patients. One group of patients is looking for that perfectly natural implant that is right in the middle of the range recommended by biodimensional planning principles. I see a second group of patients that are looking for the fullest implant volume that their body's natural tissues can reasonably conceal. Both are fine choices, and I'm happy to do both for each group of patients, as long as we're staying within the limits, within the constraints of biodimensional planning principles.